Hi, I'm Dr. Kalynda C. Smith. I'm an associate professor in the Department of Psychology at North Carolina A&T State University. This presentation is entitled A Quantitative Measure of Gen Z African American Women's Health-Related Social Media Use. This presentation is part of a larger study in which we're trying to understand how social media use, especially related to health messaging, impacts the real-life health behaviors of Gen Z African American women. We're focusing on Gen Z African American women because they're more likely than their predecessors to have used social media for most of their lives and to use it very frequently. And so, if we're going to see any kind of influence, we're more likely to see it with them. In addition to that, the research that has been done on social media use, while it seems very prolific in telling us the impact of social media use on the users, very little of that research includes African Americans or African American women. And so, in order to understand how social media use impacts behaviors, first we got to know how African American women use social media at all. And so that started with qualitative interviews, asking how they use social media in general and how they specifically use health related social media. So this was with 20 Generation Z African American women. And from those interviews, we did thematic analysis to guide the creation of a social media use quantitative measure because that also was something that we could not find. And so putting all of that together, we're able to start with the answering the first question, how do Black women use social media? So what I'm going to show you are charts that are demonstrating descriptive analyses. And so further analyses do need to be done. But this gives us an idea of sort of where we can start with understanding how Black women use social media. This data is from 177 African American women between the ages of 18 and 27. So to begin with, asking what platforms they use several times a day, you can see that TikTok, Instagram, and YouTube are among their top three. So they are interested in that imagery-based social media, especially videos. Then when asked what content they were interested in as it pertains to health, they said first mental health, then diet and nutrition, fitness, beauty and self-care, and then spiritual health. And while this wasn't ranking necessarily, this was just showing us how many participants were interested in this particular content. When asked who they followed, it was first family and friends, then social media influencers, entertainment celebrities, professionals, and lastly, healthcare professionals. So this suggests that if there are health related social media messages these women are viewing, they're not very likely to be from healthcare professionals. When asked if they see nutrition posts where the poster is not trying to sell them anything, we see that 87 participants agreed, 30 strongly agreed. And so our participants are seeing nutrition posts. Who posts that content? Women, African Americans, people I follow, then Gen Z. So they're less likely to see this content from people who are their age. Now, related to exercise posts that aren't trying to sell them anything, we see kind of a 50-50 split. 16 strongly disagree, 59 disagree, 66 agree, and 13 strongly agree. And who is posting this content? Women, then Gen Z, then African Americans, and finally people I follow. So we see more of a Gen Z presence here. Moving forward, we're going to do further analyses to make sure that our social media measure is a reliable measure, and then from there determine if social media use can impact health behaviors. We're very excited about this research, and we thank you for listening.